Hi everyone, so I will be talking to you on prediabetes, diagnosis and management. So what is prediabetes? It is a state of dearranged blood glucose homeostasis. Blood glucose levels are higher than the normal but are below than the threshold for the diagnosis of diabetes. So that is what we call prediabetes. Now the diagnostic criteria of prediabetes is as follows. So if we do a fasting plasma glucose, if the result is between 100 and 125 milligrams per deciliter, that would point towards a diagnosis of impaired fasting glucose. If the 2 hour 75 grams oral glucose tolerance test is the value is around 140 to 199, then this is known as impaired glucose tolerance test. The HbA1c, a level between 5.7 to 6.4, is known as prediabetes. So these are the criteria for us to come to a diagnosis of prediabetes. Why is it important to detect and treat prediabetes? This is because the annual conversion rate from prediabetes to diabetes is estimated to be around 4 to 20%. Prediabetes is known to increase the risk of microvascular and macrovascular complications. Treatment of prediabetes will delay the progression to overdiabetes. It may decrease the macrovascular and the microvascular complications as well as the mortality. So you can see that it is extremely important to diagnose and treat this correctly. So let's have a look at the natural history of progression from prediabetes to diabetes. Now in this chart, in this graph, you can see in the topmost part, it shows the values following a post-meal glucose test and a fasting glucose test. So in the past, usually in pre-diabetic patients, we see that the first thing to become elevated is the post-meal glucose test rather than the fasting glucose. But as time goes on, both of these will increase. The lower part of the graph depicts the insulin secretion. And as you can see here, in a pre-diabetic person, there is marked increase in the insulin secretion due to insulin resistance. However, with time, the insulin levels will decrease due to the beta cell failure. And subsequently, it will end up in impairment of insulin secretion. How should a patient with prediabetes be managed? It is important to assess the metabolic risk factors and advise the patient to modify these accordingly. Pharmacotherapy also has a role in the management of prediabetes. It is also very important to monitor for progression to diabetes at least annually, because as we said before, there is a 4 to 20% increase risk of conversion from prediabetes to diabetes annually. So let's talk about metabolic risk factor modification. Primarily, lifestyle management plays an important role. So lifestyle management incorporates medical nutrition therapy, physical activity. Patients should be advised to stop smoking and consume alcohol. Stress management is also extremely important. So it is the duty of the practicing clinician to advise the patients regarding these lifestyle modification changes. It is also very important to identify the cardiovascular risk factors and take measures to control them. So therefore, blood pressure, dyslipidemia should be optimized. If the patient is overweight or obese, it is important to emphasize the importance of weight loss reduction of at least 7 to 10%. Let's talk about measures taken for weight reduction. In people with overweight and obesity, at least 7 to 10% of weight loss and maintenance is required to improve metabolic health. It's very important to focus and emphasize on the maintenance component, because that is the usually difficult part for patients to achieve. Following interventions are useful for weight reduction. Medical nutrition therapy, and this should be individualized from patient to patient. It is important to focus on physical activity, pharmacotherapy, and metabolic surgery. Prediabetes, however, itself is not an indication for a patient to undergo metabolic surgery. What about pharmacotherapy? We can consider metformin in patients with prediabetes if they are overweight or obese, if the age is less than 60 years, and if they have a history of gestational diabetes. So studies have proven a benefit of metformin in these patient populations in prevention of the progression to overt diabetes. So in summary, prediabetes is a state of dearranged glucose homeostasis, where blood glucose levels are higher than normal, but are below the threshold to diagnose diabetes. Annual conversion from prediabetes to diabetes is around 4 to 20%. Prediabetes increases the risk of microvascular and macrovascular complications, and the key management components are metabolic risk factor modification, pharmacotherapy, monitoring of progression from prediabetes to diabetes at least annually, and finally, treatment of prediabetes delays the progression of diabetes and reduces the microvascular and the macrovascular complications and the mortality as well. Thank you, ladies and gentlemen.